Gastroesophageal reflux disease and ulcers have similar symptoms, but these are two different conditions. Gerd is a condition when acid encompassed in your stomach contents comes back up through your esophagus and into your throat or mouth, which may cause you to taste food or stomach acid. An ulcer develops when the stomach's protective thick mucus layer shrinks, allowing digestive acids to eat away at the stomach's lining tissue. These two conditions can lead to severe complications without proper treatment. An ulcer occurs when the lining of the stomach is injured. The condition can be made worse by stomach acid. So, you could say the primary cause is not stomach acid. This condition is different from Gerd, which is caused by stomach acid when the stomach acid leaves the stomach and enters the esophagus. Gerd and ulcers have significant differences. An ulcerative accompanied by symptoms such as feeling intestines burning sensation in the area between the navel and sternum. Pain or discomfort 2 to 3 hours after eating. Pain that wakes you up at night. Pain that decreases after eating, drinking, or taking ulcer medicine. Blood in the stool or vomiting. As for Gerd, it's usually marked by a sour taste in the back of your mouth, dry cough, sore throat, difficulty swallowing, such as asthma, heartburn that increases in response to some trigger foods, and symptoms that will get worse when you lie down or bend over. It's best to find a doctor to ensure whether you have stomach acid or an ulcer. Commonly, when there is suspicion of an ulcer, the patient will be recommended to do an endoscopy. If the suspicion is more towards stomach acid, the doctor will perform therapeutic tests involving taking acid-reducing drugs to see if that controls the symptoms you are experiencing. Depending on how severe your symptoms are, the doctor will also perform additional tests such as blood test. The test will show whether you have been working exposed to H. pylori. Barium study. Through this test, the radiologist will take X-rays of your esophagus, stomach, and intestines to discover whether you have an ulcer or a structural problem like an obstruction causing your symptoms. Endoscope. The endoscope test is done under anesthesia while your doctor inserts a thin, flexible tube with a camera down your throat to see inside your esophagus and stomach. The camera allows the doctor to see ulcers or other problems, such as scar tissue in the esophagus caused by stomach acid. An accurate diagnosis will help you determine the right course of treatment.